Hi, my name is Lance Geist, and this is my Module 4 YouTube presentation for SATC 230 Online, Fall 2015. Alright, so my presentation will primarily outline some of the substances abused by employees in the workplace setting, as well as who should be selected to identify employees that are displaying signs and symptoms of being under the influence of some type of drug or alcohol. I'm going to talk a little bit about the regulations that cover supervisory employees and what kind of training they need to perform that function. And lastly, I'll elaborate on some of the identifiers that supervisors can look for, that they are trained to identify the visual and behavioral clues that an employee who is high on drugs or alcohol may be displaying, so that a reasonable suspicion drug or alcohol test can be administered in order to determine whether the employee is in fact under the influence. The Pipeline and Hazardous Materials Safety Administration regulation that covers the training required for supervisors is found under Title 49 of the Code of Federal Regulations, Part 199.241, Training for Supervisors. This regulation says that each employer will designate a person who can determine whether reasonable suspicion exists, and in this matter the person is referred to as a supervisor. If the employee is displaying signs of being under the influence, for that person to be administered an alcohol test. For the supervisor to be competent to perform this task, the regulation states that he or she must receive at least 60 minutes of training on the physical, behavioral, speech, and performance-based indicators displayed by a person who is under the influence of alcohol. Now, that same bit of information also extends to the Federal Motor Carrier Safety Administration's regulation, found under Part 382.603 of the same title, but they go a little further by including an additional 60 minutes of substance abuse training. This is known as the Department of Transportation's 60-60 training, which is 60 minutes each of alcohol and substance abuse training for supervisors. And of course, the employer must follow any additional regulations or rules mandated by the Department of Transportation or any other agency that they operate under, but for the purpose of this presentation, I'll only cover the aforementioned regulations. Alright, so what constitutes reasonable suspicion? A supervisor legally can't just say, hey, I think an employee is acting kind of funny, I want him tested for drugs. That's not how reasonable suspicion works. A supervisor is required to make assumptions based on the determination of behavioral, physical, performance, and speech observations performed on the employee in order to determine if he or she is displaying signs of being under the influence. Those assumptions must be contemporaneous, meaning now or in the present, and articulable, meaning the specific things that can be documented, such as what the supervisor sees or hears or smells that cause him to believe that the employee is under the influence. Lastly, the observation must be made by the supervisor. He or she cannot prescribe a reasonable suspicion test based on the words or reports of other people. They must themselves directly perform the observation in order to determine whether a suspicion test is warranted. When the supervisor performs an employee observation, he or she is primarily looking for a pattern of indicators which can assist them in determining what type of substance the employee may be under the influence of. Since the employee will likely undergo a 5-panel drug testing screen or alcohol screen if the supervisor suspects that the employee is under the influence, it's necessary for the supervisor to be aware of those substances indicators. Those substances are marijuana, cocaine, amphetamines, opiates, phencyclidine, and alcohol. When the supervisor suspects marijuana use, he or she is looking for symptoms such as a general lack of coordination or confusion, or an otherwise sleepy condition. The employee may also be unusually talkative and loud or unusually quiet. Red, bloodshot eyes and an increased heart rate are additional symptoms of marijuana use. The employee may display anxiety, fear, or paranoia over situations or issues that may not necessarily warrant such a reaction. Also, due to the pungent odor of smoked marijuana, the employee may attempt to mask the smell with excessive use of cologne, perfume, breath mints, or other odor-absorbing material. If cocaine use is suspected, then the employer should be observing an employee for symptoms such as dilated pupils and an excessively runny or bloody nose. The employee may display irrational mood swings, anxiety, be panicky or irritable, paranoid, or act erratically or bizarre. He or she may also display unusual levels of energy or talk excessively. The supervisor should additionally look for track marks on the arms, legs, and neck veins, as well as signs of needle punctures. Amphetamine users will typically have an elevated temperature, blood pressure, and respiration rate, in addition to being extremely energetic and alert. They may act very confident and feel bulletproof or superhuman. Dilated pupils, blurred vision, and dry mouth are all common side effects of amphetamine consumption, and users may also suffer sleep deprivation and loss of appetite. Opiates cause a generally sedative condition, and users experience impaired memory, judgment, and a lack of focus in conjunction to slurred or sloppy speech. The substance also causes decreased heart rate and respiration, constricted pupils, and itchy skin that the user may scratch enough to cause a rash. A user may seem ill or display flu-like symptoms and become nauseous and vomit. They will also have reduced sensations to pain, since most opiates are painkillers. Users of phencyclidine or PCP experience hallucinogenic effects and may be anxious, paranoid, psychotic, and become very aggressive or violent. Phencyclidine also causes twitchy eye movement, muscle spasms, and decreased reflexes, with an increased heart rate and blood pressure. Users will stammer and slur their words, seem confused, and stare into space. Alcohol inebriation causes rambling, slurred speech, and poor coordination and concentration. Users may display unusual mood swings, be irritable, and seem depressed. Users may sweat profusely, suffer from frequent headaches, and have unexplained weight loss. They may also be shaky and nauseous, vomit, and smell of alcohol. I hope you enjoyed my presentation, and thanks for watching.